You're hit. Not grazed, not scratched, not walk it off, champ. No, you've been ventilated. Someone installed an unwanted hole in your body, and judging by the warmth leaking down your side, they didn't ask for permission first. There's no hospital. Number 911. No sterile gloves, no beeping machines, no surgeon who looks like they've had too much coffee and too little sleep. It's just you, a bloody mess, and whatever you can grab before you either pass out or bleed out. Whichever comes first. The world ended, civilization collapsed, and you're now your own trauma center, whether you like it or not. Good news, bullet wounds don't care who you are. Bad news, bullet wounds don't care who you are. Let's get to work. Step 1. Stop the bleeding before you decorate the floor. You're losing blood faster than your common sense. The human body has about 5 liters. Lose 2, things get blurry. Lose 3, things get interesting. Lose 4, you're sightseeing in the afterlife. So grab anything absorbent. A shirt, a towel, a piece of curtain, a relatively clean sock. Yes, even that. Fold it thick and press directly on the wound like you're trying to suffocate a demon. Lean into it. Harder. No peeking. Everyone wants to peek. Don't. The second you lift the cloth, you rip away whatever clot your body was trying to build. That puts you back to step 0, except now you're woozy and seeing colors that don't exist. If it's a limb, lift it above your heart. That makes your blood fight gravity on the way out. In the apocalypse, gravity is the only thing that still works reliably, so use it. If it's your chest or stomach, congratulations, you don't get to elevate anything. Press harder, and try not to think about your internal organs sloshing around. If blood is pulsing, spraying, or looks like someone turned on a tiny red fountain, you have arterial bleeding, which is the body's version of an eviction notice. You've got about 3 minutes. Maybe. Step 2. When pressure fails, bring out the tourniquet. If the limb is still super soaker mode, you need a tourniquet. Find something at least 2 inches wide. A belt. A strip of jeans. A dog leash. A cut-up backpack strap. Do not use. Shoelaces. Cords. Wire. Those don't function as tourniquets, they function as limb guillotines. Wrap it around the limb between the wound and your heart. Pull tight. Then tight again. Then find something rigid, a screwdriver, a stick, a metal spoon, a toothbrush if that's somehow what the apocalypse gave you, and twist it like you're tightening a bolt on a sinking submarine. Twist until the bleeding stops. Not slows. Stops. Yes, it will hurt. Yes, you might scream. That means it's working. Now mark the time. Tourniquet time is limb death time. You've got roughly 2 hours before that part of you starts to die. More than 6 hours? Kiss that limb goodbye. Fun, isn't it? Step 3. Clear out the biological garbage. You've stopped the bleeding enough to not die immediately. Good job. Gold star. Now you've got to clean the wound, because whatever rode inside that bullet is not your friend. Dirt, fabric, metal fragments, a bacterial birthday party waiting to happen. If there's bottled water, use it. If not, boil water. If you can't boil water, use tap water. If there's no tap water, use whatever doesn't have visible life swimming in it. Point is, flushing the wound is non-negotiable. Pour it directly into the wound. Don't drizzle it like you're watering a houseplant. Blast that cavity like you're pressure washing a crime scene. If you have saline, use it. If you have hydrogen peroxide, use it once, just once. Peroxide kills bacteria, but it also kills living tissue, and you need all the living tissue you can get. Alcohol? Save it for drinking. On the wound it burns, it destroys healthy tissue, and it does not sterilize as well as Hollywood told you. Once you're done rinsing out the apocalypse, pat the wound dry with something cleanish. Yes, cleanish is a medical term now. Step 4. Pack the wound like you're filling a horrifying piñata. If you've ever stuffed a turkey, forget that experience because this is worse. You need sterile gauze ideal. Clean cloth acceptable. The least disgusting fabric you have, the apocalypse special. Tear it into strips. Starting from the deepest part of the wound, push the material inside gently but firmly, creating layers of pressure. You're doing 2 things. Helping the inside clot. Filling the cavity so it can't collapse and keep bleeding internally. Don't shove everything in at once like you're trying to win a speed packing contest. You want a firm, structured pack, not a wound stuffing speedrun. If the bullet went all the way through, you need to pack both holes. Congratulations, you now have 2 haunted donuts to manage. Once it's full, cover it with a bigger cloth or bandage, and tape it down with medical tape best. Duct tape, strong contender. Electrical tape, surprisingly effective. Masking tape barely counts. Scotch tape, only if you hate yourself. Step 5. Kill the infection before it kills you. A bullet might not kill you, but infection. Oh, infection will kill you with enthusiasm. If you have antibiotics, start taking them. Amoxicillin, doxycycline, cephalexin, ciprofloxacin. Take the proper dose. Take the proper schedule. Don't skip. Don't save them for later. Later doesn't exist if you die. If you don't have antibiotics, welcome to medieval medicine. Use raw honey on the wound dressing. Honey is naturally antibacterial and pulls moisture out of bacteria, dehydrating them into microscopic raisins. Garlic paste works too. Crush garlic, mix with a little oil, smear on the dressing. Yes, you'll smell like a cursed pizza. Yes, it helps. Step 6. Watch for shock, the silent assassin. Shock is the moment your body says, "Nope, I'm done," and tries to shut down. Signs: pale skin, rapid heartbeat, cold clammy sweat, shaky breathing, confusion. If you're wondering whether you're confused, congratulations, you might be. Lie down. Raise your legs. Keep warm. Sip water slowly. Not chug. Chugging will make you puke, and dehydration plus vomiting is a combo that kills. Shock is deadly because your organs stop getting oxygen. Blood pressure crashes. Cells starve. Everything inside you starts panicking in microscopic unison. Stabilizing shock keeps you alive long enough for the wound to matter again. Step 7. Don't go bullet hunting. Every movie hero digs bullets out with knives, sticks, and bad decisions. They are wrong. Unless the bullet is sticking out like a souvenir, leave it inside. Why? Because digging it out causes more bleeding, increases infection, damages tissue, turns you into an amateur surgeon with zero training. Let the wound close around it. Your body will either absorb the fragments or build scar tissue around them. If the bullet is near the surface, you can remove it later. Not now, not while you're actively dying. Step 8. Time is your new god. The first hour determines if you live. The first day determines if you stay living. After that, it's infection roulette. Change the dressing at least once daily. If it's soaked through. If it smells wrong. If it turns green, yellow, or suspiciously chunky. Redness spreading away from the wound. Infection. Fever. Infection. Pus with attitude. Infection. Foul odor. Bad infection. If any of these happen, double your honey or garlic and pray to whichever gods still pick up their phones. Step 9. Pain means you're alive. Pain is your very rude friend who tells you things are still functioning. If the pain is decreasing, fever isn't rising, and drainage is normal, you're winning. If the pain spikes, shifts, or feels wrong, that's a warning sign. Survival is a series of tiny victories. You stopped bleeding. You didn't faint. You didn't die of shock. Your wound isn't turning colors found only on poisonous frogs. Celebrate those victories. Quietly. With minimal movement. Step 10. The apocalypse doesn't care. But you do. You're still breathing. You've stopped the major bleeding. The hole in you is packed, covered, and not currently spraying like a faulty lawn sprinkler. That makes you a success story by post-apocalyptic standards. You're alive today because you didn't panic, you didn't freeze, and you didn't start digging in your own body like you were looking for buried treasure. You listened. You acted. You endured. And that's how you survive gunshot wounds at the end of the world. Not with miracle tools, not with fancy medicine, but with pressure, improvisation, and a stubborn refusal to die in a ditch. Now get up. Carefully. Slowly. There's still a world out there trying to kill you, and you're not done telling it no.